Thank you, Dr. Lozano. Hello, everyone, and thank you for joining us today. I'm going to go ahead and try and share my screen here and get us started. Okay, hopefully everyone can see. I'll first want to again say hello and welcome to everyone. I'd like to thank President Pastrick, Provost Lafferty, and Dr. Lozano for setting up this opportunity. This is the third presentation within our COVID pandemic series, and if all vaccinations go as planned, may be our first significant step towards normal. I've had the pleasure of working with UAGC, or University of Arizona Global Campus, since 2013, and I've also worked with countless public health offices throughout Illinois and Colorado. So I'm excited to share this information with you today. As a bit of a disclaimer, due to the developing nature of the pandemic, the information we continue to learn about the virus and its variants, this information, some of the recommendations may change in time. So as an additional note, as you hear the statistics and information, know that you have the power as an individual to make a significant impact by following CDC guidelines recommending vaccinations, wearing masks, and social distancing. When I first began speaking on COVID back in April 2020, it was to combat misinformation. Regrettably, it's still very present. This is one statement that's often used to discourage belief in the virus. If the media tracked the flu virus with the same intensity we do COVID-19, it would show similar results. That's just absolutely not the case. In the US, deaths due to flu and pneumonia rarely will exceed 2,000 in a week, even during the peak season. With COVID, we were seeing instances of 3,000 to 6,000 deaths a day, or 20,000 in a week. So the infection rate is more in line with trying to track the common cold, and the mortality rate is approximately 20 times higher than influenza and 10 times higher than influenza and pneumonia combined. So it is a very serious virus and must be treated seriously. What we are seeing is that significant increases in infections and variants have spread throughout the United States starting in February through today. And with nearly a year of mixed messaging and delayed responses, the United States still has felt the greatest toll from COVID-19. The number of infections currently in the United States is 32 million, and to date we've lost over 577,000 Americans, and we're losing nearly 1,000 every day still. With the world crossing 3 million fatalities as a whole, that's roughly equivalent to the entire population of San Diego County or the entire state of Iowa. If another example would help, the US casualties suffered in World War I and World War II have been surpassed by the 1 year that we've had with COVID. We lost 521,000 soldiers, and we've lost over 570,000 Americans. So this is a very, very serious pandemic. So hopefully I can convince everyone that how safe and wonderful the vaccines are. From a global perspective, the next closest country to us in terms of infection with 17.6 million is the country of India, which has a population of 1.37 billion people. So if you compare that to the 331 million we have here in the US, they have essentially 4 times our population with about half the number of cases. What's most presently concerning for us in public health is that India is seeing a massive spike in infections. Just last Thursday, they had 300,000 new cases in 1 day. That's by far the largest spike in the world, and certainly for the history of the pandemic. So extremely concerning. Given their population size and mobility, this can create some additional worldwide surges. So we need to be very, very conscientious in how we control and help India through vaccinations and travel restrictions. And thankfully, the World Collective has come together to try and help India and Brazil. We're also struggling to find, there's a new variant that's within India that the CDC is tracking. We'll talk a little bit about that later. So while pandemic fatigue is absolutely real, I'd love to have these times set aside for any other public health topic. It's just not an option right now. So we must remain vigilant. We must maintain good hygiene. We must follow protective practices, become vaccinated, and help others become vaccinated. That's a key point. I know a lot of the people that are attending this presentation have already been fully vaccinated, and that's outstanding. We now need to all reach out to those family members or those around us that are kind of hesitant and share with them our knowledge that it is safe and it is extremely meaningful. These are graphs from today. So these are the infection rates that we have in the US and throughout the world. And what's clear from this graph is that Americans really love winter holidays. And we were willing to place not only ourselves, but those we love at risk in order to travel. What also cannot be disputed is that since our peak on January 8th, we've seen a consistent decline until this February, where we saw a rise, and then we're kind of at a high plateau right now, is how you look at it. This occurred due to a constellation of factors: spring break, vaccine fears, decrease in vigilance. But as the cases start to decrease, a new majority of individuals are being admitted to hospitals due to COVID infections, and those being between the ages of 25 and 45. This is also due to a variety of factors, primarily that the majority of seniors and older adults were part of that initial wave of vaccinations. So it's these younger individuals who are not vaccinated, and there's more severe variants out there. So that combination of factors certainly is playing a role, in addition to some of the reckless behaviors we'll talk about. What I will say, though, is if you believe you're part of this freedom-seeking group and you really want to celebrate Thanksgiving and Christmas or Hanukkah or whatever holiday you celebrate in the winter with loved ones, vigilance is absolutely required for us to be able to succeed in that mission. With so many states removing all the restrictions and the careless actions listed earlier, it's tipping the scales away from our success. So we really need vaccination rates to remain high. This graph is also from today and does well to highlight the areas of greatest infection. Los Angeles County has 1.25 million, but it is seeing a huge swing towards the positive. And looking at their trend lines, Chicago has 530,000 infections, but it's also seeing a huge reduction in trend lines. Regrettably, South Florida has over 730,000 infections, and its trend line is going up. And the Metropolitan Triangle in Texas has 1.5 million infections, and their trend line is also increasing. So major urban areas have certainly been hit the hardest and are absolutely the locations where we need vaccination rates to be the highest for us to be successful in returning to normal. When the pandemic reached the US in March of 2020, we were still trying to learn about the virus and how it was primarily spread. At the time, the concern was that it was spread both through the air and through casual contact. Today, we know 100% it's respiratory droplets is how the virus is spread. So contact with inanimate objects is about a 1 in 10,000 chance of acquiring it. I know a lot of people were wearing gloves when they were picking up their groceries, and they were wiping down packages and putting boxes outside. I mean, we covered that in our April presentation, that those were best practices at the time. Today, we're learning, and we know for a fact, 1 in 10,000 chance. So it's very unlikely. You should still wash your hands, but the actual packaging itself and things like that, being able to hold on to a virus is very, very, very low. We've also learned that source outbreaks from those who don't follow safety protocols have caused significant infection outbreaks and unneeded loss of life. Examples like the Sturgis motorcycle rally, the Capitol insurrection, and now 2020 spring break season for college students. That's why we're at the high plateau we are at now. Fortunately, while the infection rates or morbidity rates, as we use in public health, remain high, mortality or death rates are not following those similar trend lines. So that's indicating our treatment options are effective. One factor that has significantly shifted the scales in the pandemic's favor is the premature removal of mask mandates. As you can see from this map, the states shown in blue have no mask requirements. You pair that with businesses being permitted to return to 50% and in some cases up to 100% fully open with no social distancing, and that's going to create some problems. Given that Texas and Florida already have 2 of our highest infection rates, these are key locations for vacationers as well. These poor restrictions are going to have a very negative impact on our progress. What's also become clear is that because states like Florida and Texas no longer have mask requirements, many Americans who believe the virus is a hoax are actually traveling to these states. So you have an influx of individuals just in that area being able to go out, and now you have an influx of people coming to vacation, bringing in, introducing new variants, new virus. It's just creating lots and lots of issues. So yeah, if you're not fully vaccinated, please do not travel. I've included this slide not to isolate any individuals, but to highlight that politics absolutely play a role in how quickly we can return to normal. Not coincidentally, you can see that the states that rush to return to no restrictions against CDC and public health recommendations are also the states that voted for the previous administration, which believed the virus was not serious. While political ideologies are absolute for each person to determine, science should not be treated as a political baton to be passed when the health of millions are at stake. For the states that have removed restrictions, public health officials were all sincerely hoping that they will become the new champions for the vaccine to help balance out their actions so that we can still achieve normal in 2021. Given that so many states are making masks optional to protect yourself and those around you, a dual layer fabric mask or basic pleated mask is still seen as the best daily protection. While many are still seeking N95 and N99 masks, they are not needed and are still in short supply for our healthcare workers. We've also seen a large spike in counterfeit N95 and KN95 masks being sold on Amazon and other online retailers, which in some instances was actually exposing the wearer to some really, really harmful chemicals. So if your mask was not approved by NIOSH, as shown on their website, then it's not a true N95 mask if that's what your health requires. So to reduce your impact on the environment and our healthcare stockpiles, please consider or continue wearing a dual layer fabric mask and wash it regularly. We were given these by HR through UAGC, and this is what I mean by a dual layer fabric mask. So you can see here that you're able to actually separate it. This is the piece that actually goes out into the environment, has our logo on it. This collects any particulates. This is the piece that touches your nose, your mouth, and this collects your particulates. It's sewn on the outer edge, but there's nothing that connects these two layers. So that prevents the passage of the virus being able to get to you. Very, very effective. So with masks in mind, multiple studies have demonstrated that gaiters and bandanas are not effective. And in the case of gaiters, actually increase your likelihood of spreading the virus and acquiring it. Due to the sheer kind of porous nature of the nylon gaiter, it very loosely restricts respiratory droplets expelled and then creates a moist surface right in front of your mouth and nose that allows any virus that you come in contact with to very easily come through it. The reason gaiters are popular is that they're very easy to breathe through. If you've ever worn one, it's like you're not wearing anything. So the way I try to compare it to people when they're asked about it is, if you're in a room filled with smoke, you would not put a pantyhose or a stocking over your head and think that you're protected or you're going to be able to block the smoke. It's the same idea with a gaiter. It's just really, really ineffective, and in many cases actually more dangerous for you and those around you. Additionally, face shields like the one shown in the middle offer little to no protection except from someone being able to cough directly in your face. The shields seem to be most popular in the southeastern United States, and unfortunately their infection rates have suffered for it. A shield is believed to be protected by some because they're used by physicians during surgeries, and that they will somehow prevent your direct breath coming back at you. What's not considered is that the shield's only worn to prevent fluid face interaction. That's why it's worn during surgery. They don't want to get blood on their face. Physicians are always still wearing a mask underneath it. So if it's actually being worn to protect you from an airborne virus, imagine yourself like driving a car with the windows down. The shield is a windshield. So, it's blocking things that are coming at you, but you're still getting air from the side. And depending on the shape of the mask or the shield, it actually creates a vortex and will accelerate the air to finding your nose and face. So it's really, really ineffective. So if you know anyone that's wearing a gaiter or a shield and thinking they're protecting themselves or protecting you, please let them know that that is absolutely not the case. This chart is showing the rates of hospitalization and death for the various age groups. As was demonstrated in April 2020, thankfully, we were consistent in showing that the highest risk does remain for those 50 years of age and older, and the most at risk are 75 years of age and older. However, due to these new variants and the vaccination trends, those who are 25 to 45 are at most risk and are the ones being hospitalized the most at this current time. As noted earlier, it's due to a variety of factors, some within their control, some outside of their control. Very fortunately, safe and effective vaccines have been developed and are being distributed throughout the United States and the world. The most exciting news is that the vaccines available have eliminated COVID deaths and very significantly reduced those that require hospitalization. Of the over 100,000 people that participated in the vaccine trials, none have died from COVID, and only a few dozen required hospitalization. For comparison, if we were to implement the infection ratios discussed earlier and place that on the 100,000 population without the vaccine, approximately 175 would have died and 500 would have required hospitalization. So the vaccines are very effective. The two most popular vaccines in the US right now are from Pfizer and Moderna, and these are mRNA vaccines. They're a new type of vaccine to protect against infectious disease, and they actually trigger your immune response and teach the cells of your body how to fight and create a new protein. So if you can imagine the normal cells of your body being this and this being the virus, they can marry up very easily. The virus is trying to make itself match up to your cells very easily. And the mRNA vaccine changes the outer shape of that cell so that the virus cannot attach and allows the time for your immune system to fight it. So they're really, really amazing. A worthy note too, the triggering of the immune system, that's the sometimes pleasant after effects that we have following vaccination. So if any of you have been vaccinated recently, I was speaking with a colleague earlier today. She just got her second shot and is not feeling great today. That's what's happening. Your body's reacting to that change in the cellular shape. It believes it has a virus, so it's reacting appropriately. The vaccines from Johnson & Johnson are viral vector vaccines and are very similar to how flu vaccines are created. The AstraZeneca one has not been approved in the US, but the Johnson & Johnson vaccine is available again. We'll discuss it more later. The key benefit with the Johnson & Johnson vaccine, though, is that it only requires that single shot, which makes it highly desirable for populations in rural areas, the homeless, or even those who have a fear of needles. Being able to get one shot as opposed to having to schedule, 1 month out, 3 weeks out in case of Pfizer, things like that can be very challenging for individuals. So the single shot option is best for some. What's most exciting for me as a parent and public health professional is that all 4 of these vaccines are very, very highly effective, and much more highly effective even than our flu vaccines. But what's often misunderstood is the difference between a cure and a preventative vaccine. So the polio vaccine is essentially a cure. If you get the polio vaccine when you're young, you're not going to get polio. Whereas with the seasonal flu vaccine, the efficacy rate's around 40%, and it will reduce your likelihood of acquiring the flu, especially the variants that we place into the shot that particular year. And if you should become infected, then your severity of your symptoms will be much less. That's how the COVID vaccines operate. They will not stop you from acquiring COVID indefinitely, but depending on the vaccine you receive, you should reduce your likelihood of getting COVID 70 to 90%. And if you should acquire the virus, the symptoms and impact to your internal organs will be far less severe. If you can recall some of our earlier presentations, even if you're asymptomatic, your lungs, kidneys, everything take a real beating with COVID. So these vaccines will prevent that severity and allow you to, basically just feel like you have a cold. 2 closing notes for this slide. If given the option, do not mix brands. Pfizer, Moderna, AstraZeneca, Johnson & Johnson, no tests have been done to see if any combination of those 2 is safe. If you receive the Johnson & Johnson vaccine, the single shot, do not seek out additional vaccines. Again, same idea. You have the Johnson & Johnson vaccine, that's protection. You don't need to seek out additional ones because they could counteract one another. Also, if you've had COVID previously, you still very much need to be vaccinated. You were infected by a single variant, and the vaccines are protecting against all the variants we're aware of. So you've only gotten one, and that immunity is diminishing. You need the vaccine to be wholly protected. Today, there are over a dozen variants of COVID-19 circulating the globe, but those of most interest to us were found in the UK, South Africa, and Brazil. These key variants of COVID, the COVID virus, have spread worldwide and have shown as high as a 60% greater transmissibility rate, especially in those who are unvaccinated. The UK variant is in all 50 states of the US and is by far the most prevalent strain circulating in the US and in Europe. Here in the US, over 44% of all of our new cases are with the UK strain. Fortunately, all the vaccines that are offered are very effective at preventing it. The primary public health concern for us with variants is not that they exist, that's entirely expected and happens with every virus, but that they've evolved so quickly and that with each mutation, they seem to spread more easily. All 3 variants discussed have mutated themselves to make infecting humans more easy. And in the case of the Brazilian variant, which is right now primarily in Florida, Illinois, Massachusetts, it's actually able to reinfect previously sick or those who are asymptomatic. So the Brazilian variant, you'll see it referenced as P.1, but that is the one that is of greatest concern now that we're fully aware of. And while all studies are, all things are still being studied, Pfizer and Moderna have both shown in their efforts that their vaccines are extremely effective against all the new variants. So UK, South African, and the Brazilian variant, and still maintain that 90% effectiveness. So what is also noteworthy is that no one who has been vaccinated with Pfizer, Moderna, or Johnson & Johnson has died from COVID infection. This is an immense success story that is often kind of buried. I could even say that it's buried in my presentation. So to reiterate, no one who has been fully vaccinated in the United States has died from COVID, and that is absolutely worth celebrating. That's a huge success story. As with most celebrations, there is another side that should be acknowledged. While the AstraZeneca vaccine is very effective and was one of the first to be developed, it has shown a very significantly reduced effectiveness against the South African variant, and also a higher risk for blood clots. 1 in 100,000 individuals who have taken the AstraZeneca vaccine have developed a severe blood clotting disorder. Not a huge ratio, but something that's worth of note, and that's why the FDA did not grant it approval. But what should be acknowledged is that the AstraZeneca vaccine is still effective at preventing death from COVID, and that's why it's still being used throughout the world. It's sort of a beggars can't be choosers situation. Of note, there is a new variant out of India, and it is cause for public health concern. There's not much to share at this time, but it does appear to be a mutation of 2 existing variants, which allows it to have both a high transmissibility rate and also the ability to reinfect individuals. Fortunately, because it's from 2 existing variants, the vaccines are still showing very highly effective rates against preventing it. But these types of variants are going to continue to come. Before moving on, I do want to speak about efficacy, as it's something that comes up often in misinformation campaigns designed to scare or discourage people from getting vaccinated. Using Pfizer's original vaccine trial as an example, they had a total of 43,448 people participate. They divided their participants into 2 groups. They had a control group, the group that would not get the vaccine, and a treatment group that would get the actual vaccine. And the common statement amongst those trying to discourage the vaccine is that they're not 100% effective. And even if at 95%, like the Pfizer one, 5% of people are still going to get sick. That's simply not true. That's not how the math works. Pfizer had 21,728 people in their control group, so they did not get a vaccine, and 162 became infected with COVID. They also had 21,720 people in their treatment group, and only 8 became infected with COVID. So claiming 95% efficacy does not mean 5% will not benefit. It means 95% fewer people who are vaccinated will become sick than those who don't have the vaccine. If it were actually 5% ineffective, as people are spuriously claiming, they would have had over 1,000 people become infected with COVID even in their treatment group, and that's just not what happened. So how can you translate this to the real world? As you hear about more and more variants, and they're certainly coming, the effectiveness rates will start to come out. This may be 80% effective or 70% effective, so we'll use 70. If the Pfizer vaccine drops to 70% effectiveness, that means in their original trial, instead of 8 people becoming sick, it's 48. 48 people out of 21,720. That's still far less than 1%. And of those 48 people, their symptoms were greatly reduced and only required hospitalization. None of them passed away. So these vaccines are extremely effective, extremely effective. One of the more common questions that I've gotten via email is when I may be eligible to get my vaccine. And thankfully, I can say that if you're over 16 years of age and can secure an appointment, you're eligible. There's no more tiers, there's no more phases or anything like that. It's just 16 and older, go get your vaccine. However, due to that initial lack of central coordination, we still have each state and county kind of determining how distribution is going to occur. And this is clearly flawed because elected officials certainly don't know how to make public health decisions. They struggle to make a lot of decisions. So fortunately, with greater coordination now being allowed by the NIH and the CDC, we are seeing an average of about 3 million vaccines a day, which is outstanding. Total vaccine doses administered in the US currently number 230 million. So that's about 29% of the total US population being fully vaccinated. 70% is our goal, and we're at 29%, so we're getting there. States like New Mexico and Maine have over 35% of their adult population fully vaccinated. New Hampshire is probably the greatest success story right now. 60% of its adult population has had their first dose or is fully vaccinated. So New Hampshire is making great strides that way, and we'll talk about some of their success there. With New Mexico, the reason they've been successful is all of their vaccine schedules are on one website. With New Hampshire, they have a call system, 211, and they actually have individuals that are there to help you find a vaccine in your area, schedule it for you, do all the kind of the legwork. So those have been great. Colorado has nothing like that. Once we achieved herd immunity is about 70% or 231 million Americans. We can start to return to a true sense of normal. As of today, we have 95.8 million Americans. So 231 is what we need, 95.8 is what we have. So we're 41% of our way to our goal. What's exciting though is that 141 million people have gotten their first shot. So that's 61% of the way to the goal if they follow through and get that second shot. So we are getting there. Additional great news is that starting last week, consumers had the opportunity to buy at-home rapid COVID tests. Binax Now, which is owned by Abbott Labs and Elum. They're available at CVS, Walgreens, and Walmart, and they're also for sale online. I've seen them. These tests have received emergency use authorization, very similar to the vaccines, and are a significant step in our continued effort to return to normal. These steps have very high accuracy rates and most importantly have an extremely low chance of a false negative. For those of you not familiar, false negative would be if I was actually positive with COVID. Let's say I was COVID infected and I took a test and it told me I was negative. That's the worst thing that you can have with a test like this, because then I would go out in the population thinking I'm healthy and spreading the virus. So these tests are very, very effective at making sure false negatives are not possible. It's 99.9%. So it's fantastic that way. The biggest drawback for these tests is the cost. Millions of Americans are in need of at-home testing for us to control this surge. And at $25 to $40 for a single testing session, it's just not what a lot of people can afford. So we need to get the pricing below $1 so that they can be freely available at local health departments, public health offices, similar to like contraceptives. Both tests claim that the cost can be offset by insurance carriers. Don't believe that. I have called Cigna on all of your behalfs, and Cigna is not covering over-the-counter medications. They will cover all Cigna testing done in the clinic, all Cigna testing done in the hospital. There's also programs that exist that if you should become infected with COVID, if you look in Workday, you have 80 sick hours instead of 40. 40 of those 80 are set aside for COVID-related events. Getting vaccinated, taking care of someone with COVID, you getting COVID and having recovery time. So those things are in place, but they will not cover over-the-counter medication, and that's basically what this amounts to. So the over-the-counter tests, if they say the insurance will cover it, that's not going to happen. All of that being said, the cost for these commercial products is going to drop as demand is realized for them, and governments have already started making them. The US government won't be far behind, and that's when they will start be given out for free. What's exciting is that all of these tests have been utilized throughout the US and the world already. These are the tests that are done in hospitals, in clinics, whenever you've had a rapid test. I've had a rapid test done. My poor 2-year-old's had, I think, 5 done for her daycare. The idea that you no longer need a prescription, you don't need to meet with a physician, that's the fantastic thing. They're very, very accurate, and they have an immense amount of speed to tell you, yes, you're infected, no, you're not infected. One thing I do want to address is the Johnson & Johnson vaccine. Its withdrawal or pause over the past month has caused a fair amount of panic throughout the United States. While I do agree an abundant amount of caution is always needed when something is given emergency use approval, in this instance, I don't believe the media exposure was actually worth the potential cost and the fear that it may have put into people. For those of you not familiar, of the approximate 8 million Johnson & Johnson vaccines given, 7 women and 1 man developed a rare clotting disorder called cerebral venous sinus thrombosis. It's when a clot can prevent blood from draining out of your brain, and this can result in blood cells breaking and forming a hemorrhage. So it's very, very serious. Of those 7 women, 2 regrettably did pass away. Thankfully, the one that was in the ICU and the other in the man, they've all recovered. That said, this is extremely rare. For example, the likelihood of you being struck by lightning in your entire lifetime is 1 in 15,300. I personally don't know anyone that's been struck by lightning, but that's the odds ratio. The likelihood of you having this vaccine complication is 1 in a million. So it's very, very, very low, very low. So the Johnson & Johnson vaccine is still very, very safe. For a more realistic reference, the likelihood of you acquiring COVID at an unmasked, unvaccinated, say, party in San Diego County is about 1 in 12. If you were to get COVID at that party, the likelihood of you dying from a COVID infection is about 1 in 100. So with that said, if you live in an area that has a high infection rate, I recommend whatever vaccine is being offered. And if you do have a choice, as we did here in Colorado, then the mRNA vaccines appear to be the most effective against the variant strains and have shown no health complications to this point. But yeah, the Johnson & Johnson vaccine are very safe. I mean, this complication of being 1 in a million, it's a very, very difficult ratio to try and wrap your mind around. I mean, if you look at the percentage on the slide, it's just very, very unlikely. So in my opinion, it's well worth the risk for the benefits that it will provide you. This slide was surprisingly one of the more challenging to write, not because of the information was difficult to find, but because of the lives lost due to the misinformation from leadership. Many anti-science groups believe that there's some type of worldwide conspiracy to have everyone vaccinated so that they can control us, or that the virus is not severe and that they're just trying to control our movements. Well, it makes for great conspiracy. It's extremely far from fact. What bothers me the most, or what's worse, is that those who are truly scared and not anti-science, but they're just scared, they're looking for a place where they can feel some sense of safety and comfort, and a time when those feelings are really, really hard to come by. And those looking for comfort and safety, finding these groups in social media, they're being pulled away in the opposite direction from reality. And that's where I'm hoping all of us can kind of help out. The numbers clearly demonstrate that every nation that has discredited science, dismissed the vaccine, refused the virus as severe, and rushed to return to normal has paid the price in the lives of innocent citizens. The US is very much included in this group. Every nation that has acknowledged the developing science, the effectiveness of vaccines, and reacted with humanity and the economy in an equal balance is either fully open or nearly open today. So if you're in the non-believer group, I do want to thank you for coming. I know attending a COVID presentation goes against a lot of the things that you believe. So I do want to thank you very much for believing here or being here. And if you take anything away from my presentation today, please have it be this. Hydroxychloroquine will not protect you from COVID or any of its variants. We wish it did. Its availability, its cheap price, it would be so fantastic if we could have it be effective. But there have been countless peer-reviewed studies. The World Health Organization even assembled what they call the Guideline Development Group, which was comprised of dozens of physicians from around the world, different faiths, different backgrounds, different exposures to COVID. And in every test they conducted, hydroxychloroquine had no impact on coronavirus or any of the variants. It actually increased your risk of medical complications if you acquire the virus. If you look at the world leaders that are on the slide, all but Prime Minister Johnson there, took hydroxychloroquine, and all three of those gentlemen, though, required ICU. It's a very, very serious thing. So please do not take hydroxychloroquine. I've also heard many times from healthcare workers that work with my wife, who's a physician, that because of their years in the industry, their immune system is strong enough that they don't need the vaccine either. This is also false. Healthcare workers are passing away every day due to COVID infections and have no greater protection than anyone else. In fact, due to their proximity to people who are wildly symptomatic, they're at a far higher risk of acquisition if they don't take protective practices. So you're placing not only your life at risk, but those around you. To see a return to normal, we must achieve what's known as herd immunity. The herd immunity will occur in waves. It's going to grow from your community to your county to your state and then out to the federal level. This is also likely the order we're going to see the nation recover from the pandemic as a whole. Once a group reaches that 70% vaccination, that's the likelihood of the virus being very, very low in that area and a new variant developing in that area very low. So 70% is the very, very far edge of the bottom edge of that herd immunity. 85% is more ideal. So as a nation, when we achieve herd immunity, the variants that are likely to continue growing throughout the world will be our return to focus. As noted previously, the new variant that's rapidly spreading through India is of significant concern. And we must also be extremely cautious with the Brazilian variant, as testing has definitely shown it has the ability to reinfect individuals who have previously been infected with COVID or were asymptomatic with other variants. Both Moderna and Pfizer have proven effective at preventing the Brazilian variant. And while the Bengal variant, the Indian variant, whatever they want to call it, is still under study, it appears very promising again that the vaccine is effective at preventing it. The Johnson & Johnson vaccine is also effective at preventing this. The effectiveness rate from Johnson & Johnson hasn't been fully released, but very effective. The ultimate goal we're looking for with these vaccines is viral control. Through viral control, the variants will be far more limited and less likely to be significant mutations, so we can create long-term vaccines. As of today, Pfizer and Moderna both are very confident their vaccines will be fully effective for at least 6 months and then see diminishing effectiveness in the months that follow. This means boosters will absolutely be needed until viral control is reached for us. So Pfizer believes at the 1-year mark, a single booster is going to be needed to maintain a high efficacy. And it's going to be potentially sooner for those who are 65 and older, maybe 8 to 10 months, because your immune systems just are not quite as fit as those who are younger than you. Additionally, when the most populous nations of the world achieve herd immunity, that's when the true sense of normal will return. But regrettably, that date is well far off in the future, given the choices of many leaders. So our goal must be to have the US achieve herd immunity and create our own sense of normal, And then we will travel at our own risk, knowing that, lockdowns, border closings, things like that are possible, but the US is still a kind of a safe bastion for us. This map highlights the county by county vaccination statistics from this morning. Once the nation is all in dark green, that's when we'll be very close to achieving herd immunity as a population. Herd immunity, again, that's 70% of our nation. The projected date for us reaching that, if everything stays kind of good for us, is July 10th. However, this is making some really large assumptions on the part of the American people, in my opinion. To achieve this goal, we would need to see a resurgence in vaccines and a continued decrease in infections. On April 1st, we had over 4 million new vaccines administered. That was our highest. Last week, our nation was below 3 million vaccines for the week. So to achieve a 4th of July celebration, as President Biden is hoping for, we need a reduced level of infections paired with an increased vaccination rate. That being said, localized normalcy will return and arrive much sooner for many regions. Depending on how your state and government and county offices operate, you could be fully open and be able to be safe. For example, Presidio County, Texas, you can see my cursor there, that's just above the cursor there, has 70% of its adult population fully vaccinated as of today. This county has achieved, the initial levels of herd immunity. So if they were not already in Texas where there are, kind of no rules, they could choose to open all their businesses without restriction, and public health would support them and help guide their efforts. For reference, for those of you in San Diego County, you're about 26%. And those of our colleagues that work in Pima County, Arizona, down in Tucson, it's about 40% of the adult population. So we're all making strides in the right direction towards 70%. Some are just taking longer than others. K through 12 schools are a bit of a different story. The current vaccinations have not been approved for use in any individual under 16 years of age. Pfizer did apply for another emergency use authorization for those 12 and older, but that's going to take some time to process. So many states are going to rely heavily upon multi-week testing for the fall semester. I know Colorado, that's what we're doing, and then the neighboring states around us, that's what they're going to do, where they'll have those rapid tests, and the students will just have to undergo that if they want to be in the proper school. In terms of colleges and universities, many will be requiring all students who wish to live or be on campus to be fully vaccinated. The same will be required for faculty as well. I know for here in Colorado, all of the major universities are following that trend. If you want to be on campus, you have to be fully vaccinated, regardless of status. As an aside, once these vaccinations are given full FDA approval, then employers are legally able to ask you about your vaccination status and to make the vaccines a requirement to return to the office. I'm not aware of any organizations that are planning to do this at the time of the research, but it does seem likely given the impact this pandemic has had on businesses throughout the world. So if you have a spouse that works in the private industry, that's something that they would need to consider. We are nearing normal because safe and effective vaccines exist. So the next question is, what do you do once you've received your first vaccine? And that's actually the group I'm in right now. I received my vaccine in mid-April, April 16th, and I have my second dose coming in May 8th. So what do I need to do? I need to continue to wear a mask everywhere but in my house, continue to social distance, avoiding travel, and avoid socially gathering with anyone that's not a resident of my home. The first vaccine is just the first step, and I can still acquire COVID, and we can all still suffer very severe symptoms, up to and including death if we've only had one shot. And that's something that is a bit of a disconnect, because we do have a growing number of people that are just getting that first shot thinking that's enough. And it's just not set up that way. That's not how the vaccines were designed. You need both vaccines in your body for approximately 2 weeks to achieve the protection levels being advertised. For Johnson & Johnson, it's that single shot, but again, 2 weeks in your body to get that 70–80% protection rate. Once a majority of the residents in your state or county have both vaccines, then you'll see the normal return. People returning to offices, masks being recommended as opposed to required. And if we stay the course and remain vigilant, then 2022 is going to look great for us. If we continue to have large segments of the population choosing to do something different, then a return to normalcy will take longer. Right now, based on charts and surveys, it looks like about 30% of Americans are really hesitant to get vaccinated, and we need 70% at the very, very minimum. So it's going to be a struggle. Questions I've received by email recently: can vaccinated adults interact with children and grandchildren? Yes, for adults, it's absolutely safe. While it's not completely mute, the likelihood of a child of that age developing severe symptoms is very, very low. And if they become infected, the likelihood of them passing it on to you is also very low. So yes, grandparents can absolutely interact with their grandchildren. Also, after full vaccination, should I continue to wear a mask outdoors? Unless you plan to encounter a crowd, a mask is not really needed. Taking a family picnic, camping, walking your dog, riding a bike, hiking, those are all activities where the likelihood of you encountering the virus is very, very low. You should always keep a mask on you though, because while you may be in solo company for a moment, arm's length, whatever it may be, crowds, whatever it may be, can descend. So if encountering a group, a crowd, going to a conference, concert, wherever it may be, wear a mask until herd immunity is in place. So with this great news on the horizon and a return to somewhat normal being the motivation, we have to remain vigilant and help those who need to be vaccinated to become vaccinated. The key demographic we're focusing on now is young adults. This is the group that has most frequently been hospitalized in the past month, and the variants spreading appear to be stronger. As we saw with the brief spike in March due to their spring break, many of the actions related to their activities are extremely reckless at this time. For those of you who are parents of young adults between 16 and 25, please do everything you can to help them become vaccinated and to do their best to adhere to social protections. What lay ahead of us are localized outbreaks likely to occur through the end of the year into 2022. They'll likely be isolated to youth gatherings up until the fall, winter. Once that happens, we'll probably start to see more isolated outbreaks in adults because that senior population, their vaccine effectiveness will start to trend down. So we'll start to see outbreaks there until they get their booster. Another area of increasing concern is regarding missed appointments and vaccine scheduling errors. Most states are not as efficient as New Mexico and New Hampshire. We don't have centralized vaccine systems in most states. And that's because the previous administration just left it up to each state to decide what they wanted to do. And most of them chose to pass it off to a third-party provider. CVS, it's going to be your responsibility. Walgreens, figure it out. Walmart, help us out, whatever it is. And those are just not effective strategies. So for example, my vaccine became eligible in Colorado on April 2nd, and it took me until April 16th to find a site within my area where I could get vaccinated. The pharmacy website kept giving me false confirmations and denials. And when I contacted them, they were apologetic, but said they just don't have the bandwidth to keep up with demand. So these false confirmations and challenges can be very discouraging for someone who's hesitant about the vaccine. So try to help them wherever possible. And if you're in that group, I'm happy to help you as well. We have to work with each other to be successful. The variants will continue to develop throughout the world, and vaccine manufacturers are well aware of this fact and are developing vaccine boosters to try and account for all the anomalies possible. The remaining concern is that if these variants continue to develop unchecked in some of the larger countries that we have, it's entirely reasonable to expect one will be developed or created that can kind of bypass or usurp our immune systems in a way that was not anticipated. That's why having the current vaccines be as widely distributed in the US is as important as it is, because we can very easily control international travel into and out of the US. We cannot control who comes in and out of a county, who comes in and out of a state very easily. It's just not something we're built for. So if we can get the US to herd immunity, that's where we'll really be able to have some control. The final area that may prevent us from achieving that 4th of July celebration is a premature feeling of freedom. While hope is absolutely appropriate and an excellent motivator, the idea that everything can return to normal in a matter of weeks is just not realistic. Our vaccination trend lines are moving in the wrong direction, as you can see here on this chart. This is from today. As individuals who are fortunate enough to be educated, as we all are, we must share that intelligence with others. We must remain patient, become vaccinated, and help others become vaccinated so that we know these small victories are the way that we're going to cross that finish line. Once we achieve herd immunity, how things look will be different. So it helps to actually examine how other nations have dealt with pandemics in the past to provide us insight into how our future may look. While Americans have always carved their own path, and we will do the same on our way back to normal, it does appear that fear and stress associated with surviving a pandemic does not dissipate quickly. So your mental health must absolutely be acknowledged. With this in mind, once we have achieved herd immunity at the national level, and you are vaccinated, the risk of becoming infected with anything more severe than feeling like a common cold is very, very unlikely. And that's what we all want. It will take time, but living in fear will not help us to return to a sense of normal when it's appropriate. So mask wearing will remain for many individuals as a matter of choice, and we have to respect that. And some locations may even request or require it prior to entry, especially if the operator or some of their staff are immunocompromised. We may also see a mask requirement remain on domestic travel for the foreseeable future. And thinking of international air travel, which I often do, I'd love to go. We will also most certainly see the implementation of a vaccine passport of some kind. What form it'll take is unknown at this time, but almost every nation of the EU has agreed, and the United States State Department is also in favor of one for entry. So it is coming. It's just a matter of how it's going to look, whether it's going to be put into our passport as a chip or whether we're going to carry around a little card, I don't know. Social distancing will fluctuate with locations. Restaurants and bars will probably be the first to return to normal, given they're primarily adult populations. What may not alter is the spacing that you see in supermarkets, banks, and other non-social locations. Over time, it may dissipate, but it's not going to happen nearly as quickly as you would see in restaurants or bars. Greetings with family, thankfully, will return to normal, but greetings with strangers will vary. I can say I personally won't resume shaking hands probably anytime too soon. But I'll stick with the suitable alternatives. And it'll be interesting to see how other nations and other individuals, kind of carve their own path back. There's certainly not a right way or a wrong way to do it, whatever makes you feel the most comfortable. The most important thing, though, is if you find that you're not being able to return to normal or return to a level of comfort, then counseling should be sought out, because if it's really appropriate for you to return to normal and feel better, and you're just not, that's when counseling can help. I encourage it, and Cigna, who UAGC is partnered with, will support it. Just call 1-800-244-6224. Have your insurance card handy, and they're going to help you find somebody that can help you when it's appropriate to get that counseling. But it will be important that we have a sense of feeling going back to normal, because if we live in fear, then it's not the kind of the virus wins thing, but it's just not you living your best life. And that's really what we want at the end of this. Hygiene will certainly remain paramount, at least for the next 12 to 18 months. Variants will continue to spread, and we need the vaccine to be as widely distributed throughout the world as possible. Also, as these new variants continue to spread, hand washing, not touching your face, none of that should diminish. You should still, even when everything is given the green light, please continue to wash your hands where possible and try and avoid touching your face. Even for flu, the cold, whatever it may be, touching your face is just not a great idea. One other thought I'll leave you with is the idea of the booster shots. As we've seen, the vaccine distributions hit quite a few bumps along the way for us to achieve the success that we have. So what we want to do now is prepare for that fall winter. As senior vaccines begin to weaken and they require boosters, how do we want to organize that sort of vaccination? An additional wrinkle is that by fall winter, we should have a vaccine that's available for children. Who do we want to prioritize in that setup, and how will that distribution occur? My estimation, and this is just a guess based on public health practices in other parts of the world, is that seniors will continue to be vaccinated in the traditional means we're using now, and children likely will have some combination between school facilities and adult means. So they can get vaccinated at school, or they can go to Walgreens, CVS, whatever it may be. The concern is that we're not the only nation that is in desperate need of vaccines. I mean, you look at India and Brazil now. The Brazilian president did not purchase any vaccines, foolishly, but India did, and we're still sending them more to try and help them. So the supply-demand curves are going to dictate a lot of our decisions, and that's why it's a good thing to consider these things in advance before they arrive, because we can share that with people. We don't want anyone to be shocked it's happening. Boosters are going to happen. How do we want that rollout to occur? I sincerely hope you found this content useful, and I can confidently say that our nation is nearing the finish line and the world is on the main straight. They're not quite at the finish line, but they're on the main straightaway. So while this virus has impacted some individuals far more than others, and my deepest sympathies go out to anyone who's lost someone or has been infected, the fact is that we have multiple very effective vaccines, and that is how we will achieve our new normal. We must now work to make certain that everyone who can be vaccinated is, and so we can achieve that viral control for future generations. I'll close with the same message I have in the previous two. When all of mankind has been impacted, we have yet to find a virus we cannot successfully manage. Our world will be forever changed due to this virus, so we must all strive to make sure that that change is a positive one. Thank you very much, and I'm happy to field any questions.
Thank you, Dr. Holmes. As usual, as speaking for myself, it was very informative and answered a lot of my questions. We do have some questions. We have a little time. if we can get to those. I have them written down here. Dr. Holmes, can a small group of friends who are fully vaccinated dine out?
Great question. If the restaurant itself is following basic protocols of social distancing, then yes, I would say yes. If you're fully vaccinated and your friends are also fully vaccinated, and those who are around you that you don't know are at a socially distanced appropriate level, then yes, you can dine.
Great.
But when you enter but when you enter that restaurant, wear your mask. When you sit down, you're fine. I know for a while, sitting down, you had to keep the mask on unless the food was right there. Once you sit down, you're fine. But walking into the restaurant, you should still wear your mask.
Okay, unless you're eating.
Unless you're eating or sitting down. Yeah, if you're all fully vaccinated, then once you've sat down, you're not, interacting with people that way.
Okay. Are there any updates on how long each vaccine protects us for? I think you might have spoken to this. Is there any talk about a booster shot for Pfizer?
Yes, boosters are coming. Absolutely. Pfizer and Moderna have both shown that their vaccines are fully effective at 6 months. The Johnson & Johnson vaccine, there's no reason to believe it's any less than 6 months. But Pfizer and Moderna are also saying 1 year. That's when the boosters are going to have to really be needed. And it's going to be sooner for people who are over 65 years of age or those who are immunocompromised. They're going to need a booster a little bit sooner. But yes, booster shots are going to be a requirement.
Okay. This question is, my mom is fully vaccinated and will be flying from Southern California to Illinois. Is it safe? She will be staying with us and we are now fully vaccinated. All wear masks when out and about.
Yes. I mean, it all depends on your mother's state of health, but yes, she's safe. I have my in-laws flying in. I have a little boy due in July. We're very excited for her, and I have some in-laws flying in for that. They're both fully vaccinated. And actually, air travel's pretty well protected. I mean, the air that's in an airplane is constantly being circulated. So if you're wearing a mask, you're pretty well protected. And then being fully vaccinated just adds to that protection level. So yeah, I think your mother traveling from Southern California to Illinois is perfectly safe if you're all fully vaccinated.
Great. This is I mean, you may have already answered this just now, but in your perspective on safety of air travel, what is that? And for those who are vaccinated in particular?
For those who are fully vaccinated, air travel is quite safe. Again, the air is circulated through a filter and things like that. So it's pretty safe space. Wearing a mask, if you're really worried about it, you can wear a mask and, eye protection. But being fully vaccinated, I think the mask alone is enough. And yeah, you'll be fine for air travel. If you have not been fully vaccinated and you have to travel by air, that's when it gets a little bit gray. It's really, really not recommended. So if it can be avoided at all costs, I would absolutely not travel if you're not fully vaccinated.
Okay, and we have a couple of more. Since we really do not know how long the vaccine lasts in our system to protect us, do you anticipate people needing to get the COVID vaccines each year, which I think you mentioned?
Yeah.
No, you're not knowing how long the efficacy lasts.
Yes, booster shots are going to be needed up until we get that viral control that I spoke of, where we have herd immunity at a very, very large scale. Booster shots are going to be needed every year. So think of it like the flu vaccine. And it'll probably actually, even in time, it may even mirror that, where when you go in for your flu vaccine, during flu season, that September, October time, that may be when you get your booster of COVID as well.
Great. And then after enough people have been vaccinated for herd immunity and case rates get much lower, will it still be best to wear a mask in places where many people are around, even though the mask may not be required in that state? Mainly because you could still possibly get COVID even after being fully vaccinated.
Yes, it's each person's personal choice. That's what I was mentioning. We want you to live your best life. And if we've achieved national herd immunity, there's always going to be people that don't have the vaccine. Even with influenza, the vaccine rates are very low. With COVID, it's not going to be, it'll be higher, but it's never going to be 100%. So the likelihood, once you're vaccinated and you're in that, that window of full effectiveness, the likelihood of you getting the virus is very, very, very low, very, very low. So if it makes you feel more comfortable, then absolutely wear one. But once we've achieved herd immunity, it's not really going to be a need. But if it makes you feel better, then go for it.
Okay, and a couple of more. What are the vaccination rates for minorities in the United States?
Quite poor. Thank you for asking that. Unfortunately, Minorities, especially with the Hispanic, those who identify as Hispanic and those who identify as Black, are very, very poor vaccination rates. Asian Americans, it's just, they're very, very low rates. So if you are a minority or you are friends with someone who's in a minority group, feel comfortable asking them about their, their opinion on the vaccine, not if they've been vaccinated, but just their opinion on it if you don't know already, and encourage them to get vaccinated. I know, in speaking with a colleague earlier, that many Hispanics are avoiding the vaccine due to a belief that the vaccines were developed with human embryos. That is not the case. I know some are doing it because they believe that the Pope is not in support of it. You can go to the Vatican website and see the current Pope and the Pope Emeritus, Benedict, I believe is his name, and Pope Francis is the current Pope, both getting vaccinated with Pfizer. So the vaccines are endorsed, the vaccines are safe. For the African American population, there's some understandable fear of the vaccine as far as trust towards medicine. And there's also a lack of education and just a lack of overall support. There's just not a lot of African Americans who are getting the education they need on the vaccine and how important it is for their community. You can see, I've seen many, many documentaries and read many articles on the idea that they will wear the mask outside, but when they're talking with friends, even though they're not vaccinated, they'll take their mask off because it's just a collegial space and they trust their friend. It's just not, that's not how viruses work. I trust Yvonne as much as anyone, but if she wasn't vaccinated and I wasn't vaccinated, we'd both be wearing a mask. And that's just not how certain cultures and groups are operating. So we need to provide as much education and assistance to minority populations as possible to have them be vaccinated. It's very important.
Thank you, Charles. And our last question for the day is, if someone who is fully vaccinated contracts COVID and recovers, is there any research yet on long-term side effects? It may be too soon for this one, I'm not sure.
Long-term side effects aren't really well known. You're correct on that. You can acquire COVID. The likelihood of the symptoms being severe enough for you to ever have a hospitalization or anything like that is very, very low. But yeah, the likelihood of you acquiring COVID, especially if you get to that 1 year mark, things like that, it does increase slightly, but it's still not significant. But the long-term effects are unknown. What we do know is the acute effects, heavy impacts to your lungs, that ARDS, the acute respiratory distress syndrome I showed previously in the last presentation, that's likely to happen, kidneys being impacted. So you need the vaccine to keep those symptoms at a minimum. If you do get COVID and you are vaccinated, you're already going to be in a very well protected state. So the long-term impacts are going to be pretty low.
Okay, that's our last question of the day. Want to thank everyone again for attending and participating. And we are planning, I'm sure, additional COVID updated presentations in the future. And we hope to see you then. Dr. Holmes, again, thank you for a great presentation and for your constant, consistent support.
Oh, thank you very much. And thank you for everybody who was able to attend.